going back to the side effects of the vaccine, there's some concern with pregnancy. People are worried about infertility. What do you know about those issues and what should happen in that situation?
So there was some stuff that came out several months ago. There was a German scientist that postulated this, and it got some momentum that let's say you have a pregnant mother and you have a fetus and then you have placenta. The placenta has a protein called syncytin 1. And syncytin 1 had maybe a few sequences that were similar to the spike protein. And one article I read likened it to having a 10-digit number and having 17 in this 10-digit number and 17 in this 10-digit number. I'm not a virologist, I'm not a geneticist, so I don't know exactly how close these are, but I know it wasn't close enough really, and this theory has been debunked basically because there have been no changes in the fertility rates of people that have gotten COVID, the virus itself. And we don't believe that it's affected and caused more prenatal abortions or spontaneous abortions that have happened, miscarriages, if you will. So we don't think it's affected that. And plus, the V-Safe program that goes along with the vaccines is a program where we give responses to the vaccine itself. There was a certain number in those studies that Glenn was talking about of the thousands of people that signed up for it. There was a certain number, several thousand, that were pregnant. And they looked at the outcomes of those pregnant people versus the outcomes of the general population. And they saw no increased risk of miscarriage. They saw no increased risk of genetic abnormalities or malformed infants, congenital variations, those kinds of things. So we don't have any definitive data because we haven't studied pregnant people. But this is retrospective data that tells us that we believe it is safe. On a clinical basis, if you ask me as a family doc, I don't do obstetrics anymore, but I would ask a patient who was pregnant to talk with their OB about it. What I can tell you is that pregnant people who get COVID, the virus itself, infection, are at higher risk of getting serious illness. So it's a delicate decision. If I were to give advice, and this is a touchy situation, I would tell my first trimester pregnant person maybe to wait till the second or third trimester. This is the only give that I have, give in, if you will, to an unknown part about the vaccines. Glenn, you want to
Kevin,
add to that?
there was an article coming that I just read last week that is now showing data that pregnant women who are vaccinated and even women who were vaccinated before they become pregnant are passing this antibody to their baby. So the babies are being born with immunity to COVID.
Mm-hmm.
And that's the blessing of the human body. Some antibodies, so healthy women can pass their immune system, their antibodies to their baby to help protect their baby.
Not only through the placenta, but through lactation
Yes.
also, with breast milk.